John, we're coming to you to talk about small businesses, which I think my Facebook feed has been super filled with as people are talking about their favorite restaurants, their favorite independent shops, retailers, printings, like everything that gets done in a city. So many of these businesses are locally run, and they really make our cities the places we want to live. So, how has the federal government stepped in to support these people?
Yeah, it's a big deal. If you want to restart the economy, you've got to work on small businesses because they represent a huge portion of the economy, obviously. The biggest part of this stimulus for small businesses is a loan program that would be
Okay.
administered by the Small Business Administration. That part of the funding is about $350 billion. It would allow businesses to take out loans for up to $10 million, low interest loans. If they use that money to keep their employees on, then a lot of that money can not have to be paid back, can be forgiven.
That's
And
super. Hey, John, I do want to ask real quick. We have it says small businesses are fewer than 500 employees. What does
yeah.
that number mean?
Right. So that's the way small businesses are typically defined, less than 500 employees. There was a last minute change in the bill that put it to 500 employees per location. So think about a restaurant chain that has, think about, an Italian restaurant chain that's got many different employees in different locations. They'll be able to apply for this money as well as a single shop that you think of as a traditional small business.
That's really, really interesting. Okay, so I'm going to let you get back to you were saying loans can be forgiven because I'm like, boy, if you took out a $10 million loan, I mean, that might take forever for a company to pay back. And you're saying most people won't take out $10 million. And for the loans they do take back, they could have a percentage of that forgiven. Talk to us about that.
That's absolutely right. If they do what the government wants these small businesses to do, which is to keep their employees on, to keep their payroll going, to pay mortgages or debt or other things that they need to do to keep the businesses open. And so if they do that, then a portion of this money can be basically forgiven for them.
Boy, I know that money just cannot come fast enough. So thank you for that insight, John. I'm going to bring everybody else up for just a second, and we are going to talk about big businesses. Now, I know it's small businesses that often have our hearts, and certainly, there we're like, I am getting takeout half the time with my life, but it's big businesses that are right now often supplying us with the everyday household items that so many of us need. So we're going to talk about the big chunk of money that is going out to specific industries. And I want to start with the one that's most, I think, in our hearts and in our minds. John, talk to us about what's in the stimulus bill for hospitals, doctors, medical organizations.
Sure. So there's a couple of big, like, top line provisions. One is just a fund, $100 billion fund that can be used by hospitals and healthcare facilities, doctors' offices, and so forth. So that's just money that's going to go out sort of in the form of grants. Another maybe more technical, I don't want to get wonky, but wonkier thing that they're going to do is they're going to change the Medicare reimbursement rate. So, when an older patient or someone on Medicare goes into the doctor, the government pays the hospitals or doctors through Medicare. For patients that are coronavirus positive, they're going to increase the payment by 20%. So that's a pretty significant increase, actually, in the share that docs would get reimbursed. And so those things combined, hospitals alone think they're going to wind up with more than $100 billion in government stimulus money through this package. And the rest of it will go to doctors, nurses, and other healthcare providers.
And that 20% is interesting. I assume it's intended to reflect the increased pressure on like actual material goods needed to treat coronavirus. Like people are using their masks and their gowns more frequently. You need to replace all this stuff.
Yeah, that's it. And also, I just think that, the reimbursement rates through Medicare are a huge driver of everybody's health insurance. People don't realize, when Medicare sets a price, that's a price that a lot of us end up paying, not just people on Medicare. The government frequently uses these reimbursement rates in Medicare to sort of incentivize different things in the medical market. And this is a way where they can quickly get money to these places that need it through the reimbursement.